خانم‌ها و آقایان، اسم من فرزانه است. من 30 سال است و با 6 اولاد دارم. اولادای من در خانه پیدا میشن که کمک یک دایی وقتی که اولادای من پیدا میشه من دنبال خانه نمیکشم. Good afternoon, ladies and gentlemen. This quote was from a woman named Farzana, one of my participants women in Afghanistan. She spoke to me about giving birth under the traditional significance of the term Purdah. Purdah, meaning curtain, meaning curtain in Dari, is what it means is the seclusion of men from women using clothing such as the burqa. I'll return to Farzana's story a little bit later. Every 30 minutes, an Afghan woman dies due to birth complications. 78% of these deaths are avoidable. My thesis project looks at overall issues and challenges of maternal health in Afghanistan. For the purposes of this presentation, I'll focus on 2 empirical episodes that exemplify the relationship between rural maternal health care in relation to urban maternal health care and the embodiment of how Afghani notion of Purdah comes into play. My methodological approach was to travel to Afghanistan for 2 months. I spent 1 month in Kabul conducting participant observations in Malay Maternal Hospital. I also spent 1 month in rural villages in Kunduz to conduct interviews and oral histories with mothers and traditional midwives. The significance of this talk is to think through Afghan femininity of Purdah in relation to biomedical practices that policymakers, NGOs, and medical professionals in Afghanistan use to understand maternal health. After analyzing my data, I have realized that in order to understand maternal health in Afghanistan, it is essential to know the cultural significance of Purdah. Purdah, meaning curtain, is a religious and social institution of female seclusion observed by women in Afghanistan, Bangladesh, Pakistan, and northern India. More simply, it's the practice of preventing men from seeing women. This takes 2 forms: physical segregation of the sexes and the requirement that women cover their body as so to cover their skin and conceal their form wearing something like the burqa. Today, Purdah takes on different forms and significance depending on region, time, socioeconomic status, and local culture. In the case of Afghanistan, I define Purdah as a conceptual tool to analyze 2 episodes I'm about to describe. Purdah is a gender-oriented social mechanism that is used in form of empowerment, such as creating a sense of female dignity. Conversely, Purdah is used by male chauvinists and Taliban extremists to subjugate women in a fundamentalist ideology. Purdah is the foundation of family and kinship that is based on ethical understanding of what is moral behavior. Episode 1 exemplifies the relationship of a woman transversing from rural to urban healthcare setting. I met Shabnam at Malay Maternal Hospital. Here's the story she shares with me. She's a young, beautiful Turkmen woman who lives in rural Kunduz with her in-laws. During her first and only pregnancy, the men in her family did not allow her to deliver at a hospital. She said they told to her, no matter what, you have to deliver at home, practicing some form of Purdah. The first night she was experiencing intense labor pains, her husband went to a nearby clinic to get her medication. She was in labor for 4 nights and 5 days. Finally, her husband's family decided to take her to a hospital. There were no cars, so they tied her to a stretcher, and 16 members of her family were carrying her to the nearest hospital. In the middle of the journey, they had to put the stretcher down because the baby's head was out of her body from 11 a.m. to 12 p.m. They decided to take her to a near relative's home where the woman tried to pull out the baby using scarves with force out of her body. She had multiple ribs broken due to the huge amount of pressure the woman put on her abdomen to get the baby out. 7 a.m. the next morning, they found a car to take her and the baby to the hospital. Unfortunately, the doctors were not able to save her baby, and she spent 35 days in the hospital getting treatment for the damages done to her body during pregnancy. The significance of this empirical episode is that every aspect of Shabnam's maternal health circulates around the notion of Purdah, from being pregnant to giving birth to recovery. Here we see male chauvinism enacted by her husband and her in-laws imposing opposite of female dignity. My second empirical episode exemplifies birth taking place in rural Kunduz. It was Farzana's story that I quoted in Farsi at the beginning of my presentation. I met Farzana in a rural village in Kunduz. She's a 30-year-old Pashtun woman and a mother of 6. Farzana delivers all her children at home with the help of a traditional midwife. What she shared with me in that quote was that she delivers her children with her tumban, meaning her pants on, because she's practicing a form of Purdah. She only takes her tumban off or her pants off so the traditional midwife can cut the umbilical cord of the baby. Farzana then asks the traditional midwife to leave the room so that she can have her privacy of undressing herself and removing her placenta along with cleaning her bodily fluids discharged during labor. Farzana stated that God created mother strong enough to endure natural birth by herself and embrace their femininity. She mentions that allowing another individual, whether it's a female or a male, to see her body is not practicing Purdah. Her interpretation of Purdah is that if she shows her body to the traditional midwife before the baby's head emerges, it is a sign of disrespect to her womanhood and to the traditional midwife. The significance of this empirical episode is that the factors contributing to maternal deaths in Afghanistan is not only about the 3 delay model, which is delay in decision to seek care, delay in transportation, delay in receiving care. It's about educating Farzana on healthy practices of Purdah from a biomedical perspective, and also educating medical practitioners on the significance of Purdah so that Farzana can practice Purdah and not have to put her life and her baby's life at risk. In this talk, I have emphasized how maternal health care in Afghanistan is often disconnected from the cultural nuance, especially Purdah. What I have illustrated is that the integration of biomedical practices and the notion of Purdah to end horrible health conditions for women in Afghanistan. At the end, it's not only about modernization, funding, and U.S. withdrawal. It's about redefining the meaning of health to cater towards cultural sensitivity. It goes beyond the biomedical practices of reproduction. It's about understanding traditional systems that exist within different regions and then weaving that into health education. In order to even attempt to find solutions for maternal health, it is essential to understand the needs of Afghan women at most basic level, which is their need of recognition, respect, and their cultural identity of Purdah. If policymakers and international NGOs facilitate the notion of Purdah with biomedical practices, it gives Afghan women a deeper awareness of maternal health and healthy femininity and brings through the notion of Purdah. Thank you so much.
So I thought the way you started your presentation was brilliant, and I think it's a new way of conceiving of a research presentation, performing something rather than just saying what you're talking about. How did you come up with that? What does it really mean? What maybe not what you said, but the significance of it?
I think the significance of me coming in a burqa and wearing my traditional Afghani clothes was that if you don't understand the meaning of the burqa, why I'm wearing it, it's a form of modesty for me. That's a kind of like gives me my dignity, like it symbolizes that. And if you don't understand my language, when I'm speaking to in Farsi, and then you don't understand the beauty that's inside, the me, myself, my personality, then how are you going to be able to help me? So we have to integrate culture into biomedical practices in order to help these Afghan women at ground level. We can't just implement our ideas into a culture because they're not going to take it, right? So you have to give respect to the community you're working with, and then you're going to gain respect back, and things are going to work. So, yes.
Just a question about language. I noticed in the Farsi presentation that you started with Assalamu alaikum, which is Arabic.
Yes, and it's an Arabic word, but it's used in Middle Eastern languages, like for example in Urdu, it's also used Assalamu alaikum it's used as, it means peace, and like it means hi in Farsi. So it's used throughout the Middle East in different countries.